Welcome to MedWise, the channel where we break down medical issues affecting our communities in ways that are simple, clear, and powerful. Here, we tell the stories behind the headlines, explore the ethics behind the decisions, and shine a light on the heroes working tirelessly to keep us healthy. From the bustling hospitals in our cities to the quiet villages in the countryside, MedWise brings you the truth, the challenges, and the solutions in healthcare. So if you care about health, justice, and the people who make a difference, you're in the right place. Don't forget to like, share, and subscribe, because together, we can make health knowledge truly powerful. Now, let's dive in. What if the true heroes of public health were not found in the shining wards of city hospitals or the lecture halls of teaching institutions, but in dusty roads, forgotten villages, and crowded slums? What if I told you that the people quietly transforming lives every single day are often unseen, unheard, and uncelebrated? These are the community health practitioners, the invisible frontline of healthcare, the people who bring medicine, comfort, and hope directly to doorsteps that the rest of the world too often forgets. Imagine this: a small rural village at the edge of a forest, where electricity is unstable, clean water is scarce, and the nearest hospital is more than 30 kilometers away. One night, a child falls seriously ill with a high fever. Panic sets in. The family has no vehicle, no money for transport, and the father is away working in another town. The mother paces, desperate, holding her child close, listening to the labored breathing. Then, a familiar sound, footsteps at the door. It's the community health practitioner who serves this area. She has walked through the night with a small medical kit slung over her shoulder. She examines the child, gives urgent treatment, calms the frightened mother, and promises to return the next day to check on recovery. For that family, in that moment, she is more than a health worker. She is a lifeline. These stories rarely make headlines. No cameras are there to capture the tears of relief, the whispered prayers of gratitude, or the tired smile of the health worker who knows she must now walk another 5 kilometers to reach her next patient. And yet, across Nigeria, across Africa, across the world, this is happening daily, quietly, steadily, heroically. But who are these people? What makes them so vital to our healthcare system? Why do they matter so much, yet remain so invisible? And why, if they are so essential, do we still neglect them? To answer that, we need to step back and understand the journey of the community health practitioner. These are men and women trained rigorously, not just in medicine, but in communication, cultural understanding, and the art of trust. Their training is deep, practical, and grounded in the realities of the communities they serve. They learn to diagnose common illnesses, provide preventive care, support mothers during childbirth, monitor malnutrition, vaccinate children, and educate families about hygiene and disease prevention. But their real power lies not just in what they know, but in who they are. They come from the same soil as the people they serve. They speak the same language, eat the same food, and live the same struggles. When a mother opens her door to a community health practitioner, she is not opening it to a stranger in a white coat. She is welcoming a neighbor, a trusted confidant, someone who understands her world. This trust is a powerful medicine in itself. Imagine trying to convince a community to vaccinate their children when rumors are swirling about harmful side effects. A doctor from the city might come in with statistics and charts, but suspicion remains. Yet when the community health practitioner, someone they have known for years, says, "I gave this vaccine to my own child, and he is healthy," suddenly the walls of fear begin to crumble. Trust becomes the bridge between science and belief, between healthcare and acceptance. And yet, despite their immense value, the story of community health practitioners is also one of struggle. They often work with very little, sometimes no proper medical supplies, sometimes without protective gear, sometimes even without salaries for months. Many trek long distances through unsafe terrains, braving bad weather, wild animals, or even conflict zones, just to reach patients who might otherwise be abandoned. Some face stigma, being dismissed as not real doctors. Others risk their lives during outbreaks, Ebola, Lassa fever, cholera, going door to educate, to treat, and to contain the spread. But let us not paint them only as victims, Because time and time again, community health practitioners show that resilience is their second name. Take, for example, the story of a community health practitioner in northern Nigeria who, with nothing but determination, turned her small home into a community clinic. She used a wooden table as an examination bed, a plastic basin as a sterilization unit, and her voice as the strongest tool of persuasion. Within months, she had reduced maternal deaths in her village, simply by ensuring that pregnant women received basic antenatal care and health education. Or think of the community health practitioner in a riverine community in Bayelsa State, who travels by canoe every day, carrying vaccines in a cooler balanced carefully between his knees. For him, every paddle stroke is a battle against distance and time, but also a declaration. No child in his community will be left unprotected. These are the faces, the hands, the voices of community health, the ones who show us that health is not just about hospitals, but about human connection. And yet, as we tell these stories, we must also confront an uncomfortable truth. Despite their sacrifices, despite their successes, community health practitioners are often left in the shadows. Policy discussions ignore them. Budgets neglect them. The media rarely highlights them. And so their voices remain faint, their impact underappreciated. But here's the challenge. If we continue to ignore them, we risk the very foundation of public health. Because the reality is that no healthcare system can succeed without strong community health. Hospitals may treat, but community health practitioners prevent. Hospitals may cure, but community health practitioners protect. And in a world where epidemics spread faster than ever, prevention is not a luxury. It is survival. So as you listen, I want you to ask yourself, why do we celebrate doctors and nurses, but forget community health practitioners? Why do we fund skyscraper hospitals in cities while rural communities remain starved of basic care? And what kind of health future are we building if we continue to neglect the people who serve at the very roots of society? The story of community health practitioners is a story of both triumph and tragedy. Triumph in their daily victories against disease, ignorance, and neglect. Tragedy in the way they are left unsupported, unrecognized, and undervalued. But this story is not finished. And how it ends depends on us, on the choices we make as individuals, as communities, as governments, as nations. Because healthcare is not just about medicine. It is about justice. It is about equity. It is about the belief that no one, no matter how poor or remote, the ones keeping it alive in the hardest places are the community health practitioners. And this is just the beginning of their story. To truly understand the power of community health practitioners, we must step into their world, the classrooms where they train, the communities where they serve, and the lives they touch every day. Picture a training hall in a modest college of health sciences. The classroom may not be air-conditioned, the windows may be cracked, but the energy is alive. Here sit young men and women, many from humble backgrounds, determined to become community health practitioners. They study anatomy, physiology, pharmacology, among other courses. They practice how to take blood pressure, how to deliver a baby safely, how to recognize the warning signs of deadly diseases. Their training is not easy. It demands long hours, sleepless nights, and a resilience born from knowing that what they are learning could one day mean the difference between life and death for someone in their community. But the classroom is only part of their education. The real test comes when they are sent into villages and settlements during their community postings. There, they face reality, patients who cannot afford medication, families who rely on traditional healers, communities where superstition overshadows science. They must learn not only how to treat, but how to persuade, how to listen, how to respect culture while gently guiding people toward healthier choices. This is where the community health practitioner's unique skill shines. The ability to balance medical science with cultural sensitivity, to blend knowledge with empathy. Take the case of a young community health practitioner named Amina. In her community, women were afraid of delivering their babies in health centers, believing it brought bad luck. Many chose to give birth at home, without skilled attendants, leading to frequent deaths. Amina didn't storm in with lectures. Instead, she sat with the women, shared stories, listened to their fears, and slowly introduced new ideas. She started small, convincing just one pregnant woman to come to the clinic. That safe delivery became a testimony. Soon, another woman followed. Within 2 years, maternal deaths in that village dropped drastically. Not because of new technology, not because of massive funding, but because of the trust one community health practitioner built patiently day by day. Trust, after all, is the heartbeat of community health. Without it, the best medicine may never be taken. Without it, the most important advice may never be followed. And it is trust that allows a community health practitioner to walk into homes where outsiders would not be welcome, to ask intimate questions about childbirth, nutrition, and illness, and to receive honest answers. But trust is also fragile. It can be lost when systems fail, when promises are broken, when people see health workers struggling with no support. That is why the resilience of community health practitioners is so remarkable. Even when resources are scarce, even when they feel abandoned by the government, they continue to carry the torch of trust, knowing that without them, entire communities would be left in darkness. And yet, their work goes beyond the immediate. Community health practitioners are agents of transformation. They don't just treat diseases, they prevent them. They teach mothers how to purify water, how to space pregnancies safely, how to feed children with affordable, nutritious meals. They organize immunization campaigns that protect entire generations. They counsel young people about reproductive health, breaking dangerous cycles of ignorance. They even engage with local leaders, shifting cultural practices that put lives at risk. Imagine a single community health practitioner walking into a rural school, armed with nothing but a chalkboard and a box of mosquito nets. She explains how malaria spreads, demonstrates how to use the nets, and hands them out one by one. The children listen, laugh, ask questions. Weeks later, reports come back. Malaria cases in the village have dropped. That small act of education saved dozens of lives, spared families grief, and strengthened the community's future. This is the quiet revolution led by community health practitioners. A revolution not of loud protests or political speeches, but of countless small actions that ripple outwards, shaping healthier societies. It is easy to overlook because it doesn't make headlines. But when you add up those small victories, the impact is staggering. And yet, while they give so much, what do they receive in return? Many earn modest salaries that barely sustain their families. Some work without pay for months, driven only by commitment. Others buy basic supplies from their own pockets, unwilling to turn patients away. They often labor in the shadows of more celebrated professionals, rarely acknowledged in awards, rarely invited to policy discussions. And still, they show up day after day. This raises an uncomfortable question. If community health practitioners can do so much with so little, what more could they achieve if we truly invested in them? Imagine if every community health practitioner had a fully stocked medical kit, reliable transportation, regular training updates, and a salary that honored their service. Imagine if governments placed them at the center of health policy, recognizing them as indispensable. Imagine if society celebrated them as loudly as we celebrate doctors and nurses. The transformation would be nothing short of revolutionary. Because the truth is simple. Hospitals save lives, but community health practitioners save futures. But to appreciate the full depth of their journey, we must also confront the challenges they face head-on. And in those challenges, we will find both the cracks in our healthcare systems and the incredible courage of those who continue to serve. But every hero story has its battles, and for community health practitioners, those battles are many. Their work is noble, but it is also exhausting. Many operate with little or no resources, trying to stretch a single thermometer, a single stethoscope, or a handful of medicines to serve entire villages. Some carry their supplies in worn-out bags, patched and stitched again and again, because there is no budget for replacements. Others travel miles on foot, through heavy rains and scorching sun, to reach patients who would otherwise be forgotten. And when they arrive, they often face conditions that test their spirit. Children lying on bare mats with fevers, mothers delivering babies in candlelit huts, families drinking from the same stream where animals bathe. Yet somehow they do not give up. Take the story of Musa, a community health practitioner in northern Nigeria. During an outbreak of cholera, He worked around the clock, going door to door teaching families how to treat water with simple purification methods. He had no protective gear, no reliable transport, and often no food to eat during his long journeys. But his persistence paid off. The outbreak slowed in his community. Later, when asked how he managed, Musa simply said, "If I stop, people will die. And I cannot watch my people die." There is also Grace, serving in a riverine community in Delta State. Each day, she rows a canoe across dangerous waters, carrying vaccines in a small cooler. On one journey, her canoe capsized. She lost her supplies but managed to swim to safety. The very next day, with bruises still fresh, she borrowed another canoe and continued her mission. When someone asked her why she risked her life, she replied, "Because the children are waiting. If I don't go, who will protect them?" Stories like these are not exceptions, they are the rule. Across the country, community health practitioners show the kind of courage that few outside their world ever see. But their challenges are not only physical. They face systemic neglect, salaries delayed for months, promises of training that never come, health centers left to decay, with broken beds, rusted equipment, and no running water. Policymakers in air-conditioned offices speak of healthcare for all, but rarely step into the crumbling facilities where community health practitioners labor every day. The result is frustration, burnout, and sometimes despair. And yet, in the face of all this, triumph emerges. In a small town in Plateau State, maternal deaths were once tragically common. Pregnant women often arrived at health centers too late or not at all. But a team of community health practitioners decided to change the story. They began visiting women early in their pregnancies, keeping detailed records, checking blood pressure, giving advice on nutrition, and arranging safe deliveries. Within 3 years, maternal deaths had fallen by more than half. The community celebrated them, saying, "You have given our women back their lives." In another case, during the heat of the COVID-19 pandemic, while many feared leaving their homes, community health practitioners walked into villages with megaphones, teaching about hand washing, mask use, and distancing. They faced skepticism, anger, even insults. Some were chased away by people who thought the virus was a hoax. But they kept returning day after day until slowly minds began to change. Villages that first resisted began to adopt protective measures. Lives were spared, not because of big campaigns on television, but because of patient conversations at doorsteps, led by community health practitioners. These victories remind us that while community health practitioners are undersupported, they are never powerless. Their strength comes from their connection to the people, from their refusal to abandon their communities, from their deep belief that health is not a privilege but a right. But triumph should not depend on sacrifice alone. We cannot continue to demand so much from them while giving so little in return. Their stories of heroism should not mask the failures of the systems meant to support them. Every time a community health practitioner uses their own money to buy gloves or medicines, it is a testament to their dedication, but it is also an indictment of the neglect they suffer. So the question becomes, how long will we let them struggle in silence? How long will we allow a system to rely on their resilience instead of strengthening the structures that could make their work easier, safer, and more effective? The triumphs of community health practitioners shine brightly, but those triumphs should not come at the cost of their well-being. If we truly value them, we must stand with them, not just with applause, but with action. Because when a community health practitioner triumphs, it is not just an individual victory, it is a victory for the entire community, for the entire nation. We have seen their struggles. We have witnessed their triumphs. But the story of community health practitioners cannot end there with admiration alone. Because admiration without action is not enough. If these unsung heroes are to continue protecting lives, if they are to fulfill their true potential, then something must change. And that change begins with us, all of us. Think about it. For every community health practitioner walking miles with worn-out shoes, what if there was a motorbike provided? For every practitioner treating patients under a leaking roof, what if there was a properly equipped health center? For every health worker paid months late, what if there was a system that respected them with timely, fair wages? These are not luxuries. These are basic investments in the people who carry the weight of our healthcare system on their shoulders. Governments must recognize that without strong community health, national health is an illusion. No matter how many big hospitals rise in cities, if the villages remain neglected, epidemics will spread, and preventable deaths will continue. Community health practitioners must be included at the center of health policy, not as afterthoughts, not as fillers for gaps, but as core professionals whose work sustains the foundation of healthcare. Organizations, both local and international, must step up to equip and train them. Partnerships should provide medical kits, continuous education, protective gear, and the technology to make their work more effective. Imagine a community health practitioner with access to a simple mobile app that allows instant consultation with doctors in tertiary hospitals. Suddenly, distance becomes less of an obstacle, and lives that would have been lost can be saved. And what about us, the public, the viewers, the ordinary citizens? We too have a role. We can amplify their stories. We can demand policies that prioritize them. We can volunteer, donate, or support initiatives that empower them. Even something as simple as sharing their story, acknowledging their existence, can create ripples of awareness that reach decision-makers. But more than that, we must change the way we think about healthcare heroes. Too often, our minds go only to doctors in white coats or nurses in crowded wards. And yes, they are heroes too. But the heroism of community health practitioners is no less. When they sit in small homes teaching mothers how to mix oral rehydration salts, when they persuade fathers to vaccinate their children, when they risk stigma to counsel young girls about reproductive health, they are saving lives in ways that often prevent the need for hospitals in the first place. The time has come for us to broaden our definition of healthcare, to understand that the future of health is not built only in high-tech hospitals, but in the simple acts of prevention, education, and care carried out by community health practitioners in our neighborhoods. So here is the call to action. To governments, fund them, equip them, respect them. To organizations, train them, protect them, strengthen them. To communities, trust them, support them, stand by them. And to all of us listening right now, let us not allow these heroes to remain in the shadows. Because the truth is this: when a community health practitioner saves a child, they are saving the future of that family. When they protect a mother, they are protecting the heart of a community. When they prevent an epidemic, they are safeguarding the entire nation. Their work is not small. It is monumental. It is essential. And it deserves our full recognition. So the next time you think of public health, don't picture only the hospital wards. Picture the narrow footpaths, the crowded markets, the river crossings, the small villages where community health practitioners walk every day. Picture their worn shoes, their tired eyes, their hopeful hearts. Picture the countless lives they touch, often with nothing more than knowledge, courage, and compassion. And then ask yourself, if they can give so much with so little, what excuse do we have to give them nothing in return? The future of healthcare is in our hands. And in that future, the community health practitioner is not a background character. They are the lead role. They are the bridge. They are the heartbeat of health in the places where it matters most. Let us honor them. Let us support them. Let us amplify their voices until they are no longer unsung, but celebrated as the heroes they have always been. If the story moved you, don't let it end here. Share it. Speak about it. Support it. Because somewhere tonight, in a remote corner of our country, a community health practitioner is still walking, still knocking on doors, still carrying hope in a small bag. And whether the world notices or not, they will keep going. But imagine how much stronger they would be if the world walked with them. But to truly understand the depth of their impact, we must travel further. Beyond one community, beyond one story, let us journey across different regions, where community health practitioners continue to stand as the invisible pillars of public health. Let us begin in the northern savannah, where the sun beats down on vast fields of millet and sorghum. Here, in a small settlement far from the nearest paved road, lives a young boy named Musa. Musa was only 4 years old when a cholera outbreak swept through his village. His parents, worried and confused, had no idea what the sudden illness was. They had no money for a distant hospital, no transportation, and no knowledge of the danger. But one woman arrived, carrying a small kit and a calm voice, the community health practitioner assigned to the area. She moved quickly, recognizing the signs of dehydration, administering oral rehydration solution, and teaching the family how to prepare safe water. She did not just treat Musa, she educated the entire household. She walked door to door in the community, warning neighbors, helping them build simple latrines, teaching them about boiling water. Weeks later, the outbreak had been contained, not by a fleet of ambulances or a major hospital intervention, but by the knowledge and persistence of one community health practitioner. Today, Musa is alive and well, running with his friends in the fields, because someone cared enough to bring health to his doorstep. Now let us shift to the east, where dense forests surround scattered villages. Here, in the early hours of dawn, a woman named Amara went into labor with her third child. Her first 2 deliveries had been at home with tragic outcomes. One stillbirth, one infant lost to neonatal complications. This time, she feared the worst, but her story would be different. A community health practitioner had been visiting her throughout her pregnancy, checking her blood pressure, giving her iron supplements, counseling her on nutrition, and preparing her for safe delivery. When the labor pains came too soon and too strong, the practitioner acted swiftly. With confidence, she managed the situation, but she also knew when to refer. She coordinated with a nearby health center, arranged transport, and rode with Amara through the night. Hours later, a baby girl's cry filled the hospital room. Amara wept, not from sorrow, but from joy. That baby, her first to survive, was named Chidinma, meaning God is good. But in truth, it was not only divine grace. It was the careful, compassionate work of a community health practitioner that brought mother and child safely through. In the southern creeks, where boats replace cars and mangroves stretch endlessly, we find yet another story. The rainy season brings floods, and with floods come mosquitoes. Malaria stalks the villages relentlessly, claiming lives every year. But here, too, the community health practitioners are present. They paddle through rising waters, carrying mosquito nets, test kits, and anti-malarial drugs. They hold community meetings in stilted huts, teaching families about prevention. They don't just distribute medicine. They build trust, listen to fears, and dismantle myths. Slowly, steadily, malaria rates in these areas decline. And while statistics may not capture the individual tears spared, the families spared, the children who sleep under nets and wake healthy, the truth is undeniable. Lives are being saved, quietly, consistently, courageously. And then we move west, into bustling towns on the edge of rural lands, where poverty and urbanization collide. Here, young people are vulnerable not just to diseases but to misinformation. Teenage pregnancies, unsafe abortions, and the spread of sexually transmitted infections cast long shadows. But community health practitioners step in as guides. They are not just providers of medicine. They are educators, counselors, and mentors. They gather young people in safe spaces, teaching them about their bodies, their rights, their choices. They give them the courage to say no, the wisdom to protect themselves, the knowledge to build healthier futures. Through these journeys, we begin to see the tapestry of impact. Different regions, different challenges. One common thread, the presence of community health practitioners, tirelessly weaving health into the fabric of society. But their work is not only about disease and medicine. It is also about resilience in times of crisis. When conflicts displace families, when floods destroy villages, when epidemics threaten entire populations, who is often the first responder? Not always the doctors in big hospitals, but the community health practitioners already embedded in the communities, already trusted, already ready. Consider the Ebola crisis that shook parts of West Africa. It was not only international agencies that fought the spread. It was local health workers, including community health practitioners, who risked their lives to trace contacts, to isolate cases, to educate communities that were terrified and misinformed. Many of them paid the ultimate price, but without their courage, the epidemic would have claimed even more lives. And even today, as the world grapples with new diseases, community health practitioners remain on the front line, the invisible shield between vulnerable populations and disaster. But here lies the paradox. Even as they save lives, they remain overlooked. Even as they hold the line, they remain underpaid. Even as they carry nations on their backs, they remain in the shadows. It is time to ask again, how long will we allow our true heroes to go unnoticed? To truly appreciate the journey of these health guardians, we must look back. Community-based health work did not emerge overnight. It was born out of necessity, shaped by history, and refined through struggle. Decades ago, long before today's programs, rural families often had no access to formal healthcare. Hospitals were built in cities, doctors were scarce, and villages were left behind. Mothers gave birth alone. Children died of preventable fevers. Entire communities lived and died without ever meeting a trained health worker. It was in this vacuum that the idea of community-based healthcare was born, a bold belief that health must not wait in distant hospitals, but must be carried into the homes of ordinary people. At first, these efforts were small, sometimes even experimental. A few health workers trained to provide the basics, clean water advice, nutrition education, simple first aid. The skeptics dismissed them. What difference can these workers make without hospitals, without doctors, without advanced tools? They asked. But then the results began to show. Vaccination campaigns succeeded because communities trusted these workers. Maternal deaths declined because women had guidance before emergencies. Outbreaks were controlled because health education spread faster than disease. Slowly, governments and global organizations took notice. The community health practitioner was no longer just a stopgap. They were becoming the backbone of primary healthcare. And yet, history also records the setbacks. Funding shortages, shifting political agendas, times when health policies favored flashy city hospitals over quiet rural clinics. Times when community health workers were sidelined, underpaid, or forgotten. Each neglect left scars. Children unvaccinated, mothers unattended, epidemics uncontained. The cycle repeated: recognition, neglect, rediscovery. But through it all, the practitioners themselves never stopped. With or without resources, with or without recognition, they kept walking. Let us return for a moment to the household level, where the story becomes most human. In a small mud-walled home in northern Nigeria, Fatima sits with her 2 children. Her youngest, Aisha, coughs weakly, her tiny chest rising and falling with difficulty. The family had tried herbs, prayers, and home remedies. Nothing seemed to help. Just when fear was turning into despair, a gentle knock came at the door. A community health practitioner, making her regular rounds, entered. She listened to Aisha's chest, checked her breathing, and immediately suspected pneumonia. With calm urgency, she explained the danger and arranged treatment at the nearest facility. Within days, Aisha's cough began to ease. Her breathing grew stronger, and her laughter returned. For Fatima, this was not just medicine, it was salvation. A life that might have slipped away was restored. Or consider David, a teenage boy in a coastal town, restless and uncertain about his future. Peer pressure had drawn him toward risky behaviors, unsafe sex, substance abuse, dropping out of school. Then a community health practitioner, noticing his struggles, invited him to a youth health club. There, David found guidance, information, and a safe place to ask questions without judgment. Slowly, his choices began to change. He stayed in school, avoided risky behaviors, and today he dreams of becoming a health worker himself. One guiding hand shifted the trajectory of his entire life. These are not isolated tales. They are echoes of thousands of households across nations, each carrying their own version of rescue, of transformation, of hope. But what about the practitioners themselves? Who cares for those who care for us? Too often, their stories are filled with exhaustion. Some walk for hours each day, yet are paid less than a living wage. Some face hostility, suspicion, even violence in communities torn by mistrust or conflict. Others watch helplessly as patients die because they lack the equipment or medicines they know could save lives. Imagine the weight of that burden, knowing what must be done, but lacking the tools to do it. And yet, they return the next day and the next because the people still need them. Policymakers debate budgets in distant capitals, while the reality on the ground is measured not in figures but in tears, in funerals, in empty chairs at dinner tables. Every delay in recognition is another life lost. Every cut in funding is another child buried too soon. Every broken promise echoes in the silence of communities left unserved. And so we must ask, when will the world learn that investing in community health practitioners is not charity, but survival? Think of your own community. Think of the families you know. Somewhere close by, there is a health worker, perhaps not in a gleaming hospital, but in a small room or under a tree or in a makeshift clinic. They are there listening, advising, treating. They may not wear the white coat of a doctor, but their presence is just as vital. They may not have the recognition of a nurse in a busy ward, but their care is no less profound. If you listen closely, you will hear their footsteps on the dusty roads. You will hear their voices teaching mothers. You will hear their quiet encouragement to fathers. You will hear their laughter with children. And if you look closely, you will see that they are not just health workers. They are threads holding the fabric of society together. And if we ignore those threads, the fabric will tear. To see the true value of community health practitioners, we must widen our lens beyond our own borders. Across the world, different nations have embraced the idea that health begins in the community, and their stories carry lessons for us all. Take Ethiopia, for instance. In the early 2000s, the government launched a bold initiative, the Health Extension Program. Thousands of women were trained as health workers, stationed in their own villages, each responsible for a cluster of households. They provided vaccinations, family planning, maternal care, and health education. At first, people doubted the model. Could these women, without medical degrees, really change national health outcomes? 2 decades later, the results speak loudly. Maternal mortality dropped dramatically. Child vaccination rates soared. Families gained trust in the system because the workers were not outsiders. They were neighbors, friends, and daughters of the same soil. Ethiopia's story proves that when you empower communities, you transform nations. Now let us cross to Asia, to Bangladesh, where a groundbreaking program turned the tide against one of the greatest child killers: diarrhea. In the 1970s, oral rehydration solution was introduced as a life-saving treatment. But how could a simple formula of salt, sugar, and water save lives if families didn't know about it? The solution came through community health workers, mostly women, who went door to door teaching mothers how to mix it at home. They used songs, drawings, and practical demonstrations. Slowly, the knowledge spread. Millions of children who would have died were saved, not by expensive hospitals, but by community health workers armed with knowledge and trust. Travel further to Latin America, and you will hear of Brazil's famous family health strategy. Instead of waiting for patients to come to hospitals, Brazil sent teams of doctors, nurses, and community health agents directly into neighborhoods. Every family was visited, every child tracked, every pregnant woman monitored. Health became proactive, not reactive, and the results were astonishing. Sharp reductions in infant mortality, better control of infectious diseases, and even improvements in education and employment, because healthier communities meant stronger communities. Each of these stories carries a mirror for Nigeria and for Africa. They tell us, community health is not a luxury. It is the foundation. It tells us, investing in these workers is not wasted money. It is the smartest investment a nation can make. And it tells us, when governments and societies choose to empower their community health workers, lives are saved on a massive scale. But here is where the challenge lies. In many parts of Africa, including Nigeria, community health practitioners still fight uphill battles. They are trained, yes, but underfunded. They are deployed, yes, but unsupported. Too often, their voices are drowned out in the noise of bigger politics, bigger hospitals, bigger egos. And yet, the truth is simple. Without them, the vision of universal health coverage will remain a dream, never a reality. Let us pause here to imagine something. Imagine a Nigeria where every village has at least one fully supported community health practitioner. Imagine that they have regular salaries, proper training, safe transport, essential drugs, and technology in their hands. Imagine that every pregnant woman is visited at home, every child vaccinated, every youth counseled, every elder supported. Imagine epidemics caught early, malnutrition addressed before it kills, and diseases managed before they spread. That Nigeria is not a fantasy. It is within reach if only we choose to make the investment. But the question is, will we? Other nations have shown it is possible. The evidence is clear. The need is urgent. The lives waiting to be saved are countless. What is missing is not proof, not capacity, but will. Political will, financial will, social will. And here is where each of us comes in. Yes, policies are shaped in government halls, but public pressure can move mountains. When communities demand better, leaders are forced to listen. When citizens raise their voices, policies change. And when ordinary people rally behind their health workers, extraordinary things happen. This is not just about healthcare. It is about dignity. It is about justice. It is about the basic human right to live without dying from preventable causes. So when we hear the stories of Ethiopia, Bangladesh, Brazil, and beyond, let us not only admire them. Let us learn from them. Let us ask ourselves, what are we waiting for? Why should Nigeria, with all its potential, lag behind in protecting its own people? Why should communities be left in the shadows when the blueprint for success is already in front of us? The future belongs to those who act. To understand the soul of community health in Nigeria, let us sit down with the voices of those who live it every day. Meet Ibrahim, a community health practitioner in rural Kano. Each morning before sunrise, he ties his worn sandals, slings a faded bag across his shoulder, and begins his walk. Inside the bag are the simplest of tools: a stethoscope, a thermometer, a blood pressure cuff, a few basic medicines, and his record book. The road is long, dusty, and lonely. Yet Ibrahim walks with determination, because at the end of that road are the families who depend on him. In his diary, he once wrote, "Today, I visited a woman in labor. She had been struggling all night. Her family was afraid, but they did not call for help until the sun rose. I examined her quickly and knew she was in danger. We carried her to the nearest health center on a motorcycle. She survived. Her baby survived. And as I write this, I feel both relief and sadness. Relief that they lived, sadness that so many others never make it because I arrived too late, or because the health center has no supplies. But tomorrow I will walk again. I cannot stop." Now let us hear the voice of Ngozi, a mother from Anambra. She recalls the time her son fell gravely ill. "My boy was hot with fever. His body was shaking. I was afraid. The hospital was too far. I thought I would lose him, but our village health worker came that evening. She tested him, said it was malaria, gave him medicine, and stayed with us until his fever broke. That woman did not just save my son. She saved me. Because if I had lost him, I would have lost my heart." Or listen to Hassan, a father in Borno, displaced by conflict. His family lives in a crowded camp, where disease spreads quickly. There is one health worker who comes every week. She is not afraid of us, even though we have nothing. She checks our children, gives us advice, and sometimes just listens. In this camp, where we feel forgotten, she makes us feel human again. She reminds us that we are not alone. These are the quiet testimonies that rarely make headlines. No cameras follow these practitioners. No reporters write their names. Yet their impact is etched into the lives of families who will never forget them. And what of the practitioners themselves beyond their diaries? Some of them are mothers too, like Amina, who balances caring for her own children while walking miles each day to care for others. Some are young men, like Chinedu, who chose this path not for wealth or fame, but out of passion. When asked why, he smiled and said, "If I can prevent one mother from crying over a child, I have done something worth more than money." These words reveal the beating heart of community health. It is not driven by riches. It is driven by compassion. It is not sustained by recognition. It is sustained by duty. Yet compassion alone cannot carry the weight forever. These voices call for more than applause. They call for justice. They call for support. Imagine if Ibrahim had a motorcycle, if Ngozi's village had a well-stocked clinic, if Hassan's camp had reliable supplies. Imagine the relief, the lives saved, the hope restored. These are not dreams too high. They are realities within reach if only we choose to care. And so, the testimonies of Nigeria's families and health workers converge into a single plea. Do not let them stand alone. But perhaps the greatest test of community health practitioners comes during crises. When the world holds its breath in fear, it is often these local heroes who keep breathing life into their communities. During the Lassa fever outbreaks that haunted parts of Nigeria, it was the practitioners who knocked on doors, warning families not to store food carelessly, teaching them to protect themselves from rats, calming the fears of mothers who did not understand the disease. When measles spread through villages, it was the practitioners who organized vaccination drives under trees, in schoolyards, in church courtyards. Their voices carried hope louder than rumors, and their hands carried protection for the children. And when COVID-19 arrived, paralyzing cities and silencing streets, it was the practitioners who stood in the gap. With little protective gear, little support, and little recognition, they went from house to house, educating, tracing, and caring. They faced suspicion, stigma, and danger, yet they kept going, because to stop would be to abandon the very people who trusted them most. Through every epidemic, every flood, every conflict, one truth remains clear. Without these practitioners, many more lives would be lost. And yet, their challenges remain. Too often, they walk alone. Too often, they work without pay, without equipment, without protection. But imagine, just imagine, what they could achieve if they were fully supported. Picture a Nigeria where every village has a motorbike for its health worker, every clinic is stocked, every practitioner is trained with the latest tools. Picture communities where no child dies from diarrhea, no mother dies in childbirth, no disease spreads unchecked because someone is always there, watching, guiding, protecting. That Nigeria is possible, but it will not build itself. So here is the call to each of us. To governments, set aside the politics and prioritize the people. Budget not only for city hospitals, but for the grassroots where life begins and life is saved. To organizations, invest not just in equipment but in training, in mentorship, in technology that connects practitioners with hospitals and laboratories. To communities, stand with your health workers. Welcome them, support them, protect them, and recognize them as your own. And to you, listening right now, your role matters too. Share the story. Speak about it. Tell your leaders you care. Donate where you can. Lend your voice to amplify theirs. Because silence allows invisibility, but voices bring recognition. Think of the faces we have met today. Musa, the little boy saved from cholera. Amara, the mother who finally heard her baby cry. Aisha, the child whose cough eased with timely care. David, the teenager who found guidance. Families in camps, families in creeks, families in forests. All touched by the quiet hands of practitioners who refuse to give up. These are not nameless figures. They are us. They are our neighbors, our brothers, our sisters, our future. And the health workers who stand with them, they are not shadows. They are the light. So let us end with this truth. Community health practitioners are not just filling gaps. They are building bridges. They are not just saving lives. They are shaping futures. They are not just workers. They are heroes. And heroes deserve more than silence. Heroes deserve our action. Heroes deserve our respect. Because they have walked for us. Now it is time we walk with them. This has been Community Health's Unsung Heroes. Practitioners leading change. If the story moved you, share it. If it inspired you, act on it. Together, we can ensure that the heroes among us are never invisible again.